dear guests and the host led by Viveka, my dear friends. It's a great privilege for me to be in front of you and do the honor of the keynote address for such a great summit. Express Health has been doing such a wonderful service for the profession for the last many decades, and we really appreciate what is being done. And this summit, which is happening, this is the 4th edition, has been helping us, and we again appreciate the Express Health for doing this. Now, the subject of the overall summit is financially fit, tech empowered. And what is being given to me is the name of the game: collaboration, partnership, and more. So I'm slightly confused how to connect these two, but one thing which I would like to say is that there is, looking back, I very strongly feel that in healthcare, we have actually been very, very behind when compared to other industries in technology. The diagnostic part, we might have gone a lot forward, even in the treatment part. But when you look at the other aspects of healthcare, we have been left behind. Why I say this is, while being a child, I used to go to a doctor and wait there, take an appointment, go there, wait, and in 2 or 3 hours, finish that consultation, do some investigations, get a medicine, come back home, 1 full day. That was what was happening when I was a child 50, 60 years back. Even now, a patient, the same thing happens for a patient. There is not much of a difference. Even now, if somebody wants to do a consultation, it is the same thing which is happening. That's very sad when many other things have completely changed. The way in which we do banking, the day in which we do retail, the way in which we do our bookings of our airline tickets, everything has changed. We don't even go to the place where we have to do the business, to the bank, for example. But here there is no change. So there is a requirement for tech empowerment. And are we financially fit? Again, it's a big question mark. I don't think we are financially fit, at least in our country when we look at, because there's a huge requirement for more of funding coming into the healthcare sector if we have to be somewhere near the quality healthcare which has to be made accessible to the people. Now, I have slightly taken a detour in my presentation. I have not gone into the fintech or financial technology or finance technology, which is being discussed in detail by many others. So I have actually looked at, as somebody who has been outside India for 30 years and who has been here. I was a student, medical student here, I was a doctor here, I practiced here, and I went out. So what has happened over this period for the Indian healthcare? So a slightly different view as a keynote to set the stage so that others can now in the 2 days, when they discuss the different parts, there may be some certain things which will come up which will help you. Now, the reality of the Indian healthcare, if you look at, we have very low supply side strength. I don't want to go into the details, the number of doctors, the number of hospital beds, and the GDP spent for healthcare. Everything is very low and there is a requirement for us. That is actually the reality. What is the hope? The hope is that both the central government and the state government is committed for more funds. And there are many schemes which have been introduced recently. I am not going into all the names of the schemes which is given here, but very recently we had the Ayushman Bharat, which is a major scheme which has been launched, giving us our hope that healthcare is going to be brighter for half of the population, that is nearly 400 million people, which has never happened anywhere in the world, and that's a great hope that we have. And what is that opportunity that we have? The opportunity is actually the understanding or the realization, at least by the people who are sitting in the government, in the public sector, that there is a private sector which is providing 70% of the healthcare, and they have to be taken hand in hand if any scheme in this country on healthcare has to be successful. That's the most important thing. Many times when policies are made, when things are being done, what is being done is taking into consideration the government facilities. Whereas the private sector, which provides 70% of the overall healthcare, is not actually in the picture. So what has to be done is a partnership. And the private sector also thinks that government is a different entity and an animal which they can't actually approach. And that has to change. There has to be a partnership. So that's regarding the opportunity. So this again is not new to you. Our healthcare spend is abysmally low when compared to many countries, even very poor countries, as well as definitely the countries, the BRIC countries, if you look at, which are our partners, we are to be along with them when we say BRICS, the Brazils, the Russia, the South Africa, China. We are far behind, as you will see here. So there is a huge requirement on the part of the government to pump in more funds into the healthcare sector, as well as for the private sector, to understand that there is more money required if there has to be good healthcare. Unfortunately, the feeling of the employers or the people who have to spend out of pocket is that healthcare is very cheap. It is not. It is something which requires significant funding, because that's a reality. In America, they spend 16% of their GDP for healthcare. In many of the developed countries, they spend 10%. And as you see here, even the BRIC countries spend large amounts, and we spend abysmally low figures. So this has to change. Now, the budget allocation this time has been fairly good when compared to the earlier times. There has been a 17% increase in the budget allocation, which is a very good thing. Now, the future of healthcare in India, as I see, is mainly if you have to have a accessibility, affordability, and quality. These are the main three pillars. Then prevention is the most important thing, and the way in which we look at prevention is very primitive, and we have to change that. And with 70% of the present healthcare spend coming from the private sector, as I told, there's a requirement for collaboration, innovation, and structuring with an open mind. Road is the only way how we can go forward. And there is a requirement for focus on technology to leap forward if we want to go from the brick and mortar. And there is a huge demand-supply gap of healthcare professionals which have to be met. So these are the important things if we are to go forward and become a country which is fit and healthy. Now I am from Kerala. So I have lived in that country, and this is one slide which I just wanted to place before you. Kerala is an example you might have seen even recently. in the Niti Aayog report that Kerala coming to be the number one state in the larger states in the country in healthcare. In all the indices, Kerala is very high. Why is it so? Is it because Kerala has more money? No. Is it because of anything else? The only thing which has happened is that long back, even when I was a child, there was a focus on education, especially education of women. And I personally feel that the best way to take care of healthcare, for that matter, anything for that matter, is to educate the women. And they are the ones who will take care of the healthcare and other areas of the future population. So Kerala invested into that, and that helped. And also Kerala has got huge focus on healthcare education. You will see all the nurses in many of the hospitals from Kerala. Again, there was a huge focus on healthcare education, which again is a very, very important thing if you are to have a good healthcare. Now, the most important thing, Kerala had huge network of rural health centers and primary health centers. Throughout the state, I used to go to rural primary health centers for my immunization, and I used to get treatment from the primary health center. Like that, anybody in Kerala used to get the treatment from the primary health care center. Is this happening effectively in the country? I am very happy that the new policy wants to start large number of primary health care centers, sub-centers as well as the rural health centers, which must be the focus. And then, how are you going to make it tech-enabled? That's the most important thing. You can't just think that by starting this brick and mortar, you will be able to do that. The way in which you will have to do that is further take it forward by way of connecting these people. The existing, RHCs and the PHCs have to be made into a PPP model where the people in that village have to get into running that PHCs. Instead of this being run by the government, it has to be the private sector also has to come into that. And there has to be new ones which are coming up. Technology has to be provided for training and treating, and locally available resources have to be used. And you have to involve the patients, the teachers and the students for the proper propagation of this. And you have to involve the media so that there is more of information spreading regarding the importance of healthcare being the most important asset of any person. And that's the only way in which we will be able to bring this to the grassroots level. Now, when we say that healthcare has to be carried to the villages, how is it possible? The only way, according to me, is by leapfrogging using the technology. The technology that we said here, the tech-enabled, if we have to make India healthy, we have to use the mobile phones and such technology where the doctor sitting in the district headquarters or in the taluka hospitals, they will have to be connected with the ASHA workers who are in the periphery, and they should be providing the healthcare advice to the people who are in the periphery. There is no way in which the huge gap between the healthcare professionals which is there and which is required and the huge demand, this can be met. The only way, like what we did in the case of the revolution in the mobile phones, is to use that for taking healthcare to the periphery through proper methods so that teaching of the people who have to deliver healthcare can be done through that, as well as treatment can be provided through that method. Now, we know that the Ayushman Bharat is a great scheme. It has done a lot of good thing in just 1 year, but there is a lot of things to be done further if it has to have full effect for providing that secondary to tertiary care beyond the primary care which I just mentioned. So we have to support that, but there has to be a lot of things to come into that. The government has to provide a lot of additional things for the private sector to come into this, which I have mentioned here, which I am not elaborating because of the lack of time. But what I just wanted to tell is, there is a requirement for more of hospitals to come up, more of doctors, entrepreneurs should come in. The government should provide viability fund gapping and lot of other soaps if the peripheral hospitals, which are there in the tier 2 and 3 cities, they have to come up with packages which can be used for the Ayushman Bharat. And one very important thing, when you look at the Ayushman Bharat allocation, 6,400 crores rupees which has been allocated. I did a calculation and found that this is very, very minimal. Our total healthcare spend which is being shown is 64,000 crores. But if you want to cover 10 crores of families for 5 lakhs rupees, I checked with the insurance companies and found that if a family has to be covered for 5 lakhs rupees for a year of 5 members, they expect a premium of 8 to 10,000 rupees. So if we take it as 10,000 rupees, and if you are to cover 10 crores of families, that means you should have 100 crores of rupees for running this program. That's a reality. Every year there is a requirement for a huge fund, and that extra has to come. Now, another very innovative way in which we can take the Ayushman Bharat to the tier 2 and 3 cities, technology being available to the people, is by the tripartite agreement which can be there between the corporate hospitals which have got good manpower, trained manpower, and they can provide that. The hospital in the periphery can provide their building and the infrastructure available, and the medical equipment companies can provide their equipment. So these two, if it is coming together, that can provide most of the treatments that are required under the Ayushman Bharat, as well as all that is required for the secondary, tertiary, and some of the even quaternary care. The most important thing for all this, if India has to become a healthy country, and even if we have money, if it is financially fit, and even if we have technology, there's a requirement for huge number of medical professionals to be trained. And that has to be a top priority if we have to move forward. Unfortunately, we have a huge gap. 600,000 doctors are required now according to some of the estimates, and every year we are producing just 50,000 doctors. How can we change that? This is a major thing, and I hope that this will be addressed. It is not easy, but it has to be done. And we have to also find how we can even reduce the time duration of some of these courses, and more of medical personnel can be made available who can be doing this service in the peripheral centers. So I just want to tell you few things as a take home from this initial address. The most important thing is that we have to increase the allocation of funding for healthcare in India. We are far below. Government as well as the private sector has to see that there is a huge increase in the funding that is available. Unless and until that happens, there can't be a good healthcare which can be delivered. Whatever we say, how much we are going to do, maybe we can do some innovative, frugal innovation, but there is a limit and there has to be money, availability of money. We have to find that. The second most important thing is the requirement of people, for which more of institutions have to come up, and we have to see that that is required if we are to become a healthy nation. Another most important thing is the public-private partnership, which I mentioned. The government as well as the private sector should realize that there has to be a collaboration, and there has to be that we have to move together if the healthcare has to be taken care, because 70% of the healthcare is happening through the private sector. With these words, and wishing all the best for the conference, let me stop here. Thank you very much.